Wanda, let me know if people are still coming in.
People are not coming in. We haven't started the webinar. As soon as the webinar, everyone comes in. Starting now.
It's 6:02.
Starting now.
Good evening, everyone. My name is Trayon White. I serve as a council member right here in the Great Ward 8. Today, we are joined by the Department of Human Services. We actually are joined by Director Laura Zallinger and her staff to address some of the issues in the community as relates to social services, housing, and a number of issues that we've been experiencing in our office, the way we can sort through some of this as a community. For those who don't know, I serve on the Human Services Committee that oversees and provides accountability to DHS. In Ward 8, we have a number of residents receiving social services, and we just want to make sure we're transparent and open for where we are during this season of the pandemic, where a lot of families are struggling, doing housing insecurities, food insecurities, and all types of other insecurities you can even imagine. So we did this call as a mechanism to address community concerns as a whole, because we get individual calls coming in every day. But we wanted to, and I want to thank the director for joining in, making herself available tonight to answer the calls. I'm in between this Zoom and another Zoom and a visual tonight. So I'll be back and forth doing the call, so I'll be turning this particular Zoom call over to my Chief of Staff, Ms. Wanda Lockridge. So, Wanda, are you here?
Yes, sir. Thank you so much, Councilmember White. What we'll get started before we move in, we'd like to just do introductions. So, Director, if you'd like for your team to introduce themselves.
Absolutely. Thank you so much. I want to, Councilmember, I know, Councilmember, you are juggling a number of meetings. So while you're here, I just want to express my sincere appreciation for you convening your constituents and inviting this conversation today as an opportunity for us to really answer direct questions and be available to bridge gaps between what people need and their experiences and what we strive to provide at DHS. So we're in that spirit joining you, and very grateful for your leadership in bringing us together with Ward 8 residents and others who may have joined. I am joined by members of my executive leadership team, and I'm going to just ask them to introduce themselves and show their faces. I have my Chief of Staff, David Ross, is here, and I'll ask David to start, and then we'll do FSA and ESA administrators, and you can introduce any members of your team as you do that. Thank you.
Thank you, Director Zallinger. Good evening. My name is David Ross, and I serve as the Chief of Staff at the Department of Human Services. And I'd like to turn it over to my colleague, the Administrator for the Family Services Administration.
You want to mute, Ms. Pierre?
Of course. Let me start over. So good evening, everyone. Thank you so much for having us here this evening. And my name is Rachel Pierre. I serve as the Family Services Administrator at the Department of Human Services. And with me, I have Noah Abraham, who is my Deputy Administrator for the Family Division. Noah, thank you.
Good evening. My name is Noah Abraham. I am the Deputy Administrator for the Families Division. In my role, I oversee all the family homeless services provision for families in the district. Thank you. I'll pass it back to Rachel.
Thank you. I will pass it to my colleague, Anthea Seymour. She can introduce herself as well as her team. Thanks.
Good afternoon, everyone. I'm Anthea Seymour, Economic Security Administration Administrator. It's a pleasure being here this evening. With me providing some additional support is Ms. Garlinda Bryant-Rollins, Deputy Administrator for the Division of Program Operations, Mr. Michael Webar, and Mr. Brian Campbell. Both of them are not on camera, but they're providing additional support. It's great to be here.
think we have everybody on your team. We will introduce our team. My name is Wanda Lockridge, and I serve as Chief of Staff for Councilmember Trayon White. And I'll turn it over to our Constituent Services Director.
Good evening.
We also have Jules Jesse, if you'd like to introduce yourself.
Hi, everyone. My name is Jules Jesse. I am the PR and Communications Consultant for Councilmember Trayon White, and I will be active on Facebook Live.
Thank you so much. So what we'll do now, we'll turn it over to Director. She has a PowerPoint. If you have questions in between, please use the question and answer, or you can put your questions in chat. We're also streaming Facebook Live, so if you have any questions, you can certainly put them as well. So at this time, I'll turn it over to the Director.
Thank you again. So I am, as I noted, we are really pleased to be with you tonight, and we have a very substantive agenda to share with you. My goal is to share information about our programs and services. If you have any issues with the department, I want you to know how you can escalate any concerns that you have and get resolution, as well as to be aware of many new programs, services, and resources that are available to residents that can help with issues where you may need support right now. So we, during the pandemic, have modified operations heavily in order to be able to continue to provide benefits and services to residents. And we are also operating many new programs that are out there to support residents to address a range of different needs that are under the responsibility of the Department of Human Services. I want to just note at the outset that people may have individual questions or concerns that pertain to their own cases, their own situations, and we won't respond to those in a public forum, but we will respond to them privately. So if you have issues where you have individual questions, do feel free, and we will put into the chat all the places where you can go to where you may have an individual concern that you can answer, and please feel free throughout to put questions in the chat. My leadership team was introduced to you, and they're there to answer questions as well in real time so that we can both be interactive and also share a lot of information with you. So I hope today's agenda is useful. People come to work at the Department of Human Services, including myself, because we are about public service, and we understand that you're our bosses. Our responsibility is to you, and we want to make sure that we are delivering in the best way that we know how the services and supports that you need. And so that is, in that spirit, we're here to share, to listen. We are really proud of a lot of the work that we've done to continue to improve the services that we offer. And we also know we have more work to do, and we are committed to that good work going forward. So today we're going to start with our operational status. I'm going to talk through programs and services and changes within the Economic Security Administration. I will then shift to the Family Services Administration and some key information about services and programs there. And as I noted throughout, we will answer questions in the chat, and we will also take some time for any questions at the end. So starting with our agency-wide operational status, of course, due to the public health emergency and COVID-19, we've had to change the way we deliver services. And in some ways, I'm happy to say that some of the ways that we've been able to change have actually been particularly helpful and made our services even more accessible to residents. So starting with homeless services, I want to note that our low barrier and emergency shelters have stayed open 24/7. And we've asked residents to use the same shelter in the same bed every night, as opposed to lining up each day. That allows us, if somebody should be infected with COVID, to be able to contact trace and to keep infections from spreading throughout the homeless services system. We have a number of ways that we've modified our shelter operations to keep people who stay in our shelter safe during the COVID-19 pandemic. And our extended hours are just one way that we've done that. We also have our call center, which is for people who need assistance with their public benefits, has been open. And I'm happy to say that while we have historically had very, very long wait times at our call center, we've continued to modify the way that we staff various services, knowing many more people are calling us over the phone. And we've seen shorter wait times at our call center, particularly over the course of the last month. Our service centers are not, our ESA service centers are not open for in-person services. But they are open for drop-off and pickup of applications. And I will share later in the presentation all of the additional ways that one can interact virtually as well to submit applications, updates, as well as recertifications for public benefits. Our outreach teams, our day center services, our Virginia Williams Family Resource Center are all operating, although operating in a way that is virtual day center services operating at limited capacity, and more detail in these programs as we go through the presentation. As I think people know, the public health emergency is extended through May 20th, and many of the modifications will last as long as the public health emergency. Now moving on to the Economic Security Administration. So ESA is charged with administering income support programs. So that's where our cash assistance programs, TANF, burial assistance, general assistance for children, interim disability assistance, refugee cash assistance are all a part of those cash programs, as well as nutrition programs or food programs, sometimes referred to as food stamps or SNAP. Those are services where people receive on their EBT card benefits for the purchase of food. And we also, and I'll talk a little bit about a special program, a pandemic EBT program later in this presentation. And Economic Security Administration also does eligibility for medical assistance. That's Alliance as well as Medicaid, all forms of Medicaid. We do not the policy, but we do the eligibility and work in close partnership with the Department of Healthcare Finance on eligibility for those programs. Next slide, please. In addition to making sure that people have access to the income supports they need, our goal is to support people to access the programs and services that help them not only get their needs met with income supports, but also to increase their earnings, to achieve economic mobility. Just about every constituent I've ever spoken with in one of our programs tells me their goal is to be able to not just get some job, but to have a career, to provide a better life for their family. And we know that our job is an important bridge, that first you need your essential. You need to be able to get your essential needs met. You need to be able to feed your children. You need to be able to pay your rent. And that, and our goal is to connect you with the rich workforce development system that allows people to have a fair shot, pursue opportunity in our community. So through our TANF program, we offer TANF employment program through a range of different vendors who either help people connect to workforce development supports where you can engage in training programs and skill building, or if you're somebody who is just looking for a job because you have work history, it is there are a range of different resources, and we've done a fair amount of work to try to personalize those services so that our customers, our residents are in the driver's seat for what it is that they need. Some of the major changes we've made in the TEP program are to really use it as take a whole family approach. We know that parents are successful when their children are doing well, but if their children are struggling, that takes the full attention of a parent. And so participating in a program can be challenging, but if that program takes into account the needs of the family and actually supports a parent around the resolution of where they're struggling with their child, not only is that child going to thrive, that parent will also thrive, and so the child will also be better off. So that is the philosophy with which we're approaching those reforms to our TANF program, and we're able to offer incentives and supports around whole family services in TANF, and that has been really well received by many of our customers, and we're looking to use that same paradigm shift throughout all of the services that we offer. We also, I won't go through there. We also, with the SNAP program, have an employment and training program where we're also connecting to the workforce development supports for residents. And I'll move on to, and there's contact information in the deck and right there up on the slide for how you can reach out and with questions or to access services from any of those programs. I mentioned that there are many ways that one can interact with the Economic Security Administration as it relates to the acquisition of the public benefit programs I just spoke about. One of them is certainly through our service centers by picking up or dropping off applications, and there are 3 of our service centers that are open for that purpose. So in person is one way. We also are really thrilled that in the pandemic, we've been able to shift much of what we do to virtual operations. So the many residents and perhaps many of you who are listening have spent hours in waiting rooms in one of our service centers. And we know how challenging that is. And we've worked really hard to reduce wait times and improve customer service there. But even better is when you can do your business with the agency online and at your convenience, as opposed to having to come in person. And we have been able to fast track some of the improvements to our technology that allow residents to do that. So you can do many applications online, and you can access that at dcbenefits.dhs.dc.gov. And we also have a mobile app that I will speak about next. But you can also call our call center, and the number is up there on the screen, 202-727-5355, is an additional way that you can ask questions or request an application be mailed to you so you don't have to come pick one up. And as well as if you interact with the agency around any issues or changes that you have. And finally, EBT cards are now mailed, but they can also be picked up at the distribution center. And while we're really thrilled that during the pandemic, we have been able to shift to being able to mail EBT cards, we know that there are challenges with the U.S. Postal Service, and it takes a while sometimes for people to get those cards. So it is important to know that you can still pick up EBT cards at our distribution centers at Good Hope Road and our H Street service centers. We know that part of improving customer service, and we can move to the next slide, is also improving the environment. When we're open, we want to be able to welcome people back into our centers because they are choosing to come into our centers, not just because they must come into our centers, and we want them to be welcoming and a place that shows that we think context matters, and we want the environment to show that we have put thought into the experience that people have when they interact with the agency. And while over the course of the last year or so, we have been finally engaged in renovations to our Anacostia Service Center, which is located across from the Big Chair. And we're excited once we reopen to unveil that together with you, but just want to share some photos that it is set up for children if they need to be there waiting with their parents. There is more sunlight, the colors are bright, and we hope for a much improved customer experience once we reopen. That is a long-awaited renovation, and we're thrilled at how it's going. The other way, which has been really helpful, and many customers have already taken advantage of this, is we have launched our mobile app called District First. Through the mobile app, customers can apply for benefits. So they can do an application for TANF, for SNAP, medical assistance programs, or they can recertify for those programs as well. You can also take a picture of documents you may need to provide to the agency right there on your phone, if you have a smartphone, and upload it into your application, as well as report changes and updates on your personal information about your household, if you've moved addresses, if you've had a baby, if there have been any changes that you've experienced, you can do that right there. You can check the status of your benefits as well, and get reminders about when to recertify for benefits so you don't experience a lapse. So this is one place where I feel really proud of the team at the department and the way that they've been able to adapt and make changes, because not only have we been able to change the way that we do services and make our services more accessible through this mobile app, but our staff have been able to work on the other end by learning new systems and processing those applications virtually. Much of that is possible because we have several waivers right now with the federal government, and so that's allowed us to do almost everything virtually with customers. If you're having problems with using the mobile app or a virtual application, you can always call our call center for assistance with using that app, and it is available in multiple languages, so not just English, but Spanish and Amharic, and it will display on any of these languages based on the preferences that you've set up on your phone. Moving to the next slide, one really important change that we want to share with you is that during most of the pandemic, up until the month of March, we were able to extend benefits without requiring anyone to recertify. So renewals were waived, interviews, people did not have to come in for an in-person interview for any of our programs or do an interview over the phone. And we were able to continue continuity of benefits due to the pandemic. What is different right now is that we are now required to do recertifications. When it's time for you to recertify, you will get a notice from the agency in the mail. And we have also done robocalls as reminders. A few things to really note. It's very important that people keep their address up to date with the department, or you will not receive that recertification notice in the mail. Now, if you've downloaded and are using the mobile app, you will get a note. You will have an alert through the app that tells you it's time to recertify as well. But this is a big shift that people do need to recertify for SNAP, and we want to make sure that if you receive that notice, you don't wait, but you go ahead and you complete that recertification, which you can do through any of those virtual methods that I just explained to you through the mobile app, through our online form, and we can even support you if you need help with that by calling our call center. But we would love to see people not see any interruption in those essential benefits that we know you rely on because you missed the deadline for doing your recertification. So please be mindful of that so that you don't see a lapse in any of those programs. We have a new program that we have offered through the pandemic that has been available through the federal government, through USDA. So this is called Pandemic EBT. What Pandemic EBT is designed to do is to replace food benefits for children who would have received meals at school. So since schools are closed and children may not be getting breakfast, snacks, or lunch at school, we know that has created a real burden on households who have relied on that for meals for their children. And this allows people to have a resource to be able to replace those school meals with a benefit. Now, it was authorized last year. It was then, it stopped at the end of September, and then it was later reauthorized to begin again in October. And USDA only then began approving plans that allow states to offer those benefits really in the last few weeks. I'm thrilled to report that we are now able to continue sort of where that gap was to offer Pandemic EBT. So how that works is that, and we have been able to issue significant benefits as well through the PBT program. So we have already issued during last school year and over the summer and for September, $35 million to district residents in food benefits. That's accounting for 70,000 district children in the PBT program. And people who are eligible for this program are people who are enrolled, children who are enrolled in a district school that participates in the National School Lunch Program and have been approved for free and reduced priced meals, also known as FARM, in the district. Or if they're enrolled in a CP school that provides free meals to every single student there. Or if they're enrolled in school and the child is part of a household that receives SNAP benefits. You do not need to do anything separate to get PBT except for make sure that if you that your child has enrolled with their school and registered for farm. So we receive the information from OSSI, from the State Superintendent for Education, about children who are eligible. If that family is already receiving SNAP, we add that benefit to your EBT card. The family is not receiving SNAP, they then received for past benefits a PBT card in the mail with benefits. And for people who may be newly eligible, they will receive a new PBT card in the mail. We will load existing PBT cards with benefits. And so the new benefit that started will be paid all the way back from October. So people will see benefits that were owed to them from October, November, December, all the way through currently, and it will go through the summer. How much would you expect to receive if you're eligible for PBT? Eligible students receive about $123 per month, and that's starting now from October through January. And if you are in a hybrid school and you're in school 50% of the time, you would see half of that, or about $74 per month. If you're in school less than half the time, you would receive the whole benefit. And if your child is in school just more than half of the time, you would receive the half benefit. So it's either 50% or the full amount. And that is something that was recently clarified by the federal government, which makes it more manageable for us to administer. So now that we have really just only received the approval from USDA to issue benefits for this school year, we are working on issuing these benefits as quickly as possible. We will continue to provide updates on the district's PBT webpage, which is you can find at dhs.dc.gov/PBT. And we expect that we will issue $93 million in food assistance to over 85,000 children through June of 2021. This is such an important resource in our community. It's important resources for children, for their families, and we know that SNAP benefits are also an important economic engine in our community as well. And so we're really thrilled about PBT, and we look forward to being able to finally issue that. We fought hard to be able to do it. Not all states have issued that benefit, unfortunately, to their residents. Now I want to tell you a little bit about emergency allotments. So the other big change to SNAP that happened during the pandemic is that Congress allotted that households who received less than the maximum benefit amount would be bumped up to receive the maximum benefit amount for SNAP. So if somebody qualified for a portion of what would be the maximum benefit based on their household size, they would get two payments: their normal SNAP payment and an extra payment later in the month that makes up the difference between the maximum amount and what they were already getting. About 55% of households who are receiving SNAP received this additional emergency allotment payment. And there's no additional work that anybody needs to do to get it. We already pay it to people if they're eligible. And that, again, would be anyone who was not receiving that. To date, we've issued over $92 million in additional SNAP benefits to over 47,000 district SNAP households. So we can only issue emergency allotments during a public health emergency where both the district and the federal government have declared it as a public health emergency. So this is right now will happen. Our public health emergency goes through May. We expect to be able to issue these benefits every single month. We need to apply to the federal government to issue these allotments, and every single month we wait for them to approve, and once they do, we pay. The FNS, the Food and Nutrition Service at USDA, our federal partners who administer this program, recently announced changes, and which we hope will be an expansion, and we're reviewing those guidance. So people may see a bit of a difference in the amount they're receiving in that emergency allotment beginning in the month of April. And we will advise residents on that. And that's really based on whatever the federal rules are and any changes that the current administration is making to how those emergency allotments are calculated. But the bottom line is we have been hard at work and busy administering these extra benefits and programs, and we know how important they are for residents as people are struggling and relying more and more on these essential supports. Want to share with you one other exciting change that's happened as well under the pandemic, which is we were one of the few states, and one of the first states actually, that was authorized for online purchasing of groceries using SNAP benefits. So you can use your EBT card, you can use your SNAP if you do not feel comfortable going into a grocery store to shop. Now, there are only a few stores right now that are approved for the district, and it's not DHS who gets to approve those. Those are actually done by the federal government, by the Food Nutrition Service and USDA, but you can through Amazon and now through Instacart, who works with Aldi. Customers can purchase food online, and those groceries are delivered to your door. So we know many people don't have access to grocery stores near them. It is difficult to travel. You may not feel safe on public transportation. And so this has been a really, really important resource for people who are really trying to social distance right now. Now, unfortunately, delivery fees are not authorized. You can't use your SNAP benefit for delivery fees. Amazon has waived the delivery fee, but only with a minimum purchase. And there is a delivery fee that you would need to pay with a different source that is not your PBT benefit if you're shopping at Aldi. But still, we're glad that we have that flexibility. You can use your PBT benefits as well for online purchasing, which is great. And we do hope that there will be other retailers added. And we know that our federal partners at USDA are working to increase options for households to purchase groceries with their SNAP benefit. So those are some key updates from ESA. I want to note that team has worked around the clock to get all of these benefits approved every single month from our partners at FNS to retrain our workforce so that they can work from home to do all the processing and adjust to all of the rapidly changing rules and launching new programs, as well as to stand up call centers that have answered thousands and thousands of questions that people have had during this time. And we appreciate everyone's patience as you've weathered these changes and seen these changes and for your family. Now I'm going to share some updates from our Family Services Administration. So I'm going to start with homeless services for families, which we know is an issue that people have a lot of questions about and is something that we've been extremely focused on since the very beginning of the Bowser administration. It's something that I also personally have worked on in very close collaboration with my team who's with you here this evening. So people access homeless services for families through the Virginia Williams Family Resource Center. Our Virginia Williams Family Resource Center right now is closed to the public, so you don't need to come in to do an application, but you can call and reach us by calling the shelter hotline. And that shelter hotline number is 202-399-7093, and it's also up there on the slide. So it is through Virginia Williams that you can access support that you need. Moving to the next slide. So what do we mean when we say access homeless services for families? And for a very long time, what we meant by accessing homeless services for families meant accessing shelter. That you need to have absolutely no place you could go, nowhere you could stay to get help from the department, and what we had to offer you was shelter. Oftentimes that was shelter at DC General or in an overflow motel. We've spent a fair amount of time reforming that entire system of care so that if there is a situation that we can help remedy before you don't have a safe place to be, then we've stood up our homelessness prevention program. So we have a number of community partners who are able to support with a whole range of ways that we, like mediation, financial assistance, relocation assistance, other rehousing supports. If there's a place that is safe, you don't need to come into shelter to get that help with where you're going to stay permanently. And that has been more than 8,000 residents have taken advantage of our homelessness prevention program and been able to address their housing crisis without having to come into a shelter. What's also changed is what does shelter look like and feel like for families? So we have now open short-term family housing sites throughout every ward in the District of Columbia. And those are brand new buildings that are built to meet the needs of families. I talked a little bit about context mattering and the environment that we provide service in mattering. And I don't know if any of you have seen the Triumph in Ward 8. It has, it's won an architectural award, so is the IA in Ward 6. But these are buildings that are beautiful. They are in community. They're up to 50 residents, not more than 10, up to 50 families, not more than 10 families on each floor. And the services and supports that are really designed so that people both feel safe and they're able to access what they need in order to attain permanency. And our average length of stay in those programs is under 90 days. We also offer, through Virginia Williams, emergency rental assistance. When somebody's not a resident, we can help connect them to supports in their home jurisdiction. And we can also, if it's not clear if someone's eligible or whether the situation they have is one that can be remedied, we can connect them with what we call an interim eligibility placement. So we can help a family come in and have a safe place and determine whether they can go back out into community or whether they need to come in and stay in shelter. For rehousing, we also have our domestic violence providers collaborating with us at Virginia Williams. So somebody who is a survivor fleeing a violent situation, we're able to support them and we connect right into the confidential services that are part of the DV system through Virginia Williams. So we've had a lot of questions about who's eligible, and it feels confusing. And I think part of the reason why it feels confusing is, one, there's a law about who's eligible, and we need to do our best in what can sometimes be really dynamic situations for families, applying the circumstances they're in to a legal framework, and to really getting to the bottom of whether a family is a safe place to be, that where we can support them to something that can be permanent, or whether they need to come into shelter as a safe place to be. At a minimum, the law requires that someone is able to demonstrate that they're a resident of the district. Most jurisdictions do not offer shelter to every family who needs it. And when they run out of shelter, they operate a wait list. And so we see a lot of people calling us from all over this region, Maryland, Virginia, even sometimes much further away from Maryland and Virginia, looking for a place because they can't get help where they're from. And so if we're going to have services that are available to our residents, we need to be able to ask some questions about residency. Now, we know sometimes families are transient and they've been staying in the district, then they go stay with a family member somewhere else. And when they can't stay there, they're having a hard time showing that they're a district resident. We understand that. And we would still consider somebody who's lived in the district within the last 2 years a resident in the District of Columbia. They have the intent of staying in the district and maintaining their residency here. They need to be a family. And what it means in our law to be a family is that you have a minor child in your care, in your custody, and that you have no other safe place to go, that you're experiencing homelessness. Now, somebody may be living with other family members and they're not getting along and they don't want to stay there, but they can stay there, or they have somewhere else they can be that is safe. In those situations, we really want to try to support someone's rehousing needs if they can stay there a little bit longer and it's safe to do so, rather than having to come into shelter to get that help. So you need to be experiencing homelessness or an imminent risk of homelessness before coming into a shelter placement. What are some ways people say, if someone is homeless and don't have documents, how are they supposed to prove any of these things? Which is also challenging. And so the list on this slide are just some examples. What are some of the documents that people can provide that show that they're a district resident? Now, if you're receiving public benefits in the district, your child's enrolled in school in the district, then it's pretty easy for us. We will look in our systems and as a way of verifying your residency. So other ways you can show your tax, income tax, your W-2. You can show a utility bill. If you're receiving unemployment benefits, show documentation of that. Your vehicle registration. If you've received an eviction notice or you have a prior lease, those are all ways you can show your residency. And so we do sometimes verify against other systems when someone's having a difficult time demonstrating their residency. So I noted that it does get complex because sometimes situations are dynamic and changing, and our goal is to really understand whether our family has access to safe housing before we issue a notice of eligibility determination. The other thing is you may be eligible, a family may be eligible for homeless services, but not necessarily need shelter. And that isn't a denial of eligibility for services, but we're really trying to match the resources we have to the situation that someone is presenting with. And if there are concerns, then there are ways to escalate those concerns that I'll get to in a moment. But our goal is to provide quality services, and we do have a supervisor who reviews every single eligibility determination that we make, and we know that we have not, while our intention is good customer service, intention is not enough if it's not what people experience, and there's a reputation that we are not providing great customer service, and we're working hard to fix that. So we do have a customer satisfaction survey that we share every single time someone interacts with us in person, and I think we do also, to the extent we can, and people are able and wanting to, we have a survey we share virtually as well to help us understand where we need to improve our customer service from Virginia Williams. The next slide. So if you have concerns about the eligibility determination, about the services that you receive, questions, you can send them to us. We have a dedicated email box that is vwfrc.concerns@dc.gov, and we want you to send us those, and that is one way you can escalate if you don't like the treatment you've received or you have a question about what happened. You can always also request to speak to a supervisor, and that is another way that we can resolve. Okay, next I'm going to move on to our rapid rehousing program for families, which is also called the Family Rehousing Stabilization Program, or FRSP. This program is designed to provide short to medium term help with rent, so around 12 to 18 months worth of help with rent to help people exit homelessness or exit a prevention program into rehousing, and to be able to find stability during that time. It also provides case management services to families. So that is our FRSP program. And this is where we know that another area we've been really focused on, how do we improve? That oftentimes families who have experienced homelessness still need more time than 12 to 18 months before they are able to pay their rent. And it becomes really challenging, particularly during the pandemic. One of the ways that we've modified during the pandemic is we have continued subsidies through the entire pandemic. So nobody has exited based on their time in the program during the pandemic. So there has been a moratorium on exits from the program. Rent subsidies are now extended until the end of June 2021 in FRSP. Case managers are doing a lot of virtual services with families, and they continue to partner with families during this period to work toward their goals around housing stability and navigating any issues with schools and what's going on with their children, and also connection to our TANF employment program, so that families are using this time in the program to be able to pursue activities to the degree to which they can to build their income. We know that we also, this is an area where we strive to provide excellence and be a foundation to support people to be able to attain stability, and it doesn't always work out, and it hasn't always been the experience that people have had. And we've heard that loud and clear. There's a lot of room for improvement in FRSP, and we've been focused on fixing it, and we started by listening to our experts, meaning the families in the program. So before COVID, we did a work group, an FRSP task force, and we invited a number of residents in the program to advise us, as well as many of our advocates, council staff, and a number of partner agencies to help us really unpack how do we use what is a short to medium term help with rent, about a 12 to 18 month rent assistance program plus services to really support families to get to a place of stability. How do we need to fix and reform that program? Some of the key recommendations that came out of that task force, and again, I really want to emphasize that we put the voice of families at the center. We know that the families who are receiving our services are the experts in what they need. We need to listen. So some of the things we heard is that we need to make more seamless connections to other programs, that there are some families who they are going to need a long-term subsidy. They have a disabling condition. They're on a fixed income. They are getting SSI. They're not going to be building their income, and they need a connection to an affordable housing subsidy and sometimes a voucher plus services targeted affordable housing or permanent supportive housing program. So we do connect people to TH and PSH. We have about less than one voucher for every 10 families who presents in our system. So that creates some challenges. Not everybody who needs that long-term voucher, that long-term housing subsidy, there is not one available. So it is really for people who have a disabling condition and who are able to connect to the long-term subsidy. Our goal is to work with others to really help them grow their income. And so through that, we were working on some joint contracting with our TANF employment program to bring in richer workforce development supports and meet families where they are and support them in how they work on building their earnings in more effective ways. And we are working on what we think is a really exciting idea, which basically protects housing subsidies while people are building their earnings so that those subsidies don't go away faster than someone builds their earnings. And we hope that that's something, it's a concept we've been working on. We talked about it in the work group, and it's something that we think there's some opportunity to pursue in the near future. So it's something we are actively looking at. Big issue that we've heard about from people are the housing conditions in their units. Now, DHS, I want to be clear, we're not the housing authority, and we partner with the housing authority. The DC Housing Authority does all the inspections, and they pay rent on behalf of DHS. We understand our responsibility as partners with them in the program to be advocating on behalf of families. So, but we also do not do the inspections, and those are done and approved by DCHA. DCHA shifted during the pandemic to do virtual inspections, and we saw an increase in complaints about the quality of the housing people were in that RSP program. We've worked very closely over the course of the last 6 to 9 months with DCHA to change some of those things. So they are doing more in-person inspections, and if things are not, they were doing all in-person inspections. Now they're doing in-person inspections. They need to go out based on a customer complaint. But when a family has an issue with housing conditions in their unit, they can work with their case manager, and their case managers are trained in what to do next, which is they need to advocate on behalf of the family with the landlord to ensure that repairs are made. If that is not happening, then they escalate the complaint to the DC Housing Authority, and they also already notify DHS, and we track together with the Housing Authority on the repair. DCHA will notice the landlord. They will go out and do an inspection, give a timeline for when that repair needs to be done, and they will work with the housing provider to be sure that repairs are made. And if that fails, we will stop paying that landlord, and we will support a family around a relocation. In cases where payments are stopped, we do offer temporary shelter placement, or if there's an issue that it's not habitable until the repairs are done, we also offer a temporary shelter placement to families in those circumstances. And if someone's approved for relocation, case managers do assist with helping families navigate that process and finding a new unit, getting that unit inspected and approved. So I talked to you a little bit about that we're really proud of our new short-term family housing sites, and we are. Most recently, our Ward 1 short-term family housing is called the Terrell, and it will open later this month. It provides 35 apartment-style shelters, and for apartment-style shelter for families, to help them attain stable housing. We also have opened during the course of the public health emergency the Ward 3 short-term family housing, which is in the Brooks and the IOT in Ward 6. Each of those sites offer 50 units. And in 2020, as families moved into stable housing, we stopped using hotels for overflow shelter. So we've been able, through our new programs, to not just improve the environment in which we're offering services, but also support families to attain housing more quickly. And by doing so, that means the same unit can serve more families over the course of a year. And people exiting our shelter program happens faster than new people needing shelter. And we have 85% fewer families in shelter than we did 5 years ago, which is a real major shift. So we have built a sustainable system that we hope can prevent homelessness more frequently, as well as support people when they do experience homelessness to reduce that time and to help them exit to housing more quickly with the services they need. And that's the area that FRSP exiting with the right services and supports where we are focusing our efforts on reforming that system, as well as improving the experiences that people have at Virginia Williams and getting the help they need when they're in an emergency. We also want to leave time for your questions. I'm going to just share one more piece of information. There are new federal funds available for rental assistance. So up until recently, what we've had to offer are the Emergency Rental Assistance Program, or ERAP. Many people are familiar with ERAP. To assist paying if you owe rent arrears and are at risk of eviction. And then during the pandemic, there's also been a program called CHAP where landlords can apply to, if their tenants have not been able to pay on behalf of their tenants, to be able to obtain rent arrears. There are new federal funds available to states in a new federal emergency rental assistance program. The district's first allotment of that is $200 million. This is going to be an incredibly important resource for people who have lost income during the pandemic and are struggling to pay their rent. Assistance in that new program can be provided for up to 12 months for arrears, as well as an additional 3 months going forward if someone still needs help with their rent. And then there is a new, and then there are new federal funds in addition to that $200 million, where if extensions are needed, we may be able to extend further. We do pay, just like with the ERAP program, pay that rent to landlords on behalf of tenants. And but if a landlord is not responding, we can pay that money directly to a tenant, so that people can preserve their tenancies, can preserve their leases, their ability to stay where they are. And landlords are explicitly allowed, and we are encouraging them to really help their tenants apply. But they must sign that form for the landlord to apply on their behalf. So who's eligible? So some of the ways that you will be able to show you're eligible are if you are receiving unemployment. If you're receiving unemployment benefits and you owe rent arrears, we're going to be able to help you in this program without having to prove your income further than that. We also can take a written attestation around your household income, or if you've experienced significant costs or other financial hardship due directly or indirectly to COVID, that can show that somebody's eligible. If you're receiving public benefits from another program, from DHS, that will also help us determine that. Or if you're at risk of experiencing homelessness or other housing instability. And what's important, an important change, is that even if somebody is receiving other housing subsidies or they're undocumented, they will still be eligible for this rent assistance program. We're preparing to launch this. We will have an online system where people can go in and apply. It does not require an interview, but it will require proof of identity, proof of income or attestation, and proof that you have a lease. And in some cases, as I mentioned, a self-attestation can be used if you cannot obtain those documents for federal funds. But these are federal funds. They will be audited. I'm not sure how well you can see the slide on the screen, and we will make these slides available and publish these, but it does go through what is the process to apply and for these emergency rental assistance funds. We will have a call center as well, a contact center where people who need assistance can, if they cannot apply online or if they have questions, to help support people through that process. So a little bit of a timeline on this. There are funds available now. And so if you, while we're still working on launching the full system and full program, if you need help with your rent, you can apply and you can get assistance through the chat program. And the link is up there on the slide. It's at dhcd.dc.gov, service COVID-19 rental assistance. We expect to be able to launch that new platform on Monday, April 12th. We're working on just final testing. We want to make sure when we launch, we are able to sustain whatever volume of applications we see, and we want to make sure that it launches in all the right ways. And so we are just in those final stages before the launch of the new platform. I think you will find it very, very customer friendly, and we will be doing a lot of outreach to landlords, to community members, to faith institutions, community organizations, and we ask that everybody who's listening also let their neighbors know that if they need help paying their rent, that you don't need to wait. That this assistance, you don't have to wait till the eviction moratorium is lifted. You can get help with your rent now. It can help you no matter when you apply, with up to 12 months of back rent, as well as some rent going forward for around 3 months, potentially 6 months if you still qualify. So we're very excited. This is a very a significant amount of money, and we know our residents need it. So I know that was a lot of information. I spoke to you for a long time. I hope you found that helpful. I've seen a lot of questions coming in to the chat, and I've seen some of them answered. But I'm going to go ahead. I'm going to ask the members of my team who are here to answer questions. Our ESA administrator, Ms. Anthea Seymour, our FSA administrator, Ms. Rachel Pierre, to join me. And I think I'm going to turn it back to Ms. Lockridge to facilitate any questions.
Great. Director, thank you so much for that in-depth, comprehensive overview of the services that you provide. There are some questions that we have both in the Q&A and the chat. So why don't I start first with the question and answer. And so the first one is, I worked at the call center with DHS, and we got calls about the PEBT, but we were told that we could not handle that. So what departments should clients actually call about the PEBT card?
Director Zollinger, do you mind if I answer that question?
I knew you were about to. Please go ahead.
Thank you. Regarding PEBT, our call center number, 202-727-5355, that's the number for our general public benefits call center. We have not yet established a call center for PEBT. We are encouraging anyone who wants to see an updated information about PEBT that they go to dhs.dc.gov/PEBT. On that link, you will see what's known as a web form. Each resident can complete.
Thank you so much. There's a question about the Good Hope Road EBT location. Is it open yet? Is it back open?
Yes, the Good Hope Road location is open. And so is H Street location as well.
Great. So we have a question here. Benefit status changed. Wait a second, let me just make sure I have the full question. What is the status of the DC Recovery Act eligible DC resident apply for $1,000?
Oh, so I think you may be asking about the federal child tax credit, and that is, and people need to apply for that directly to the federal government, or that will be reimbursed, paid out by the federal government based on your tax filing. But that is actually not something that's administered by DHS.
Thank you,
I think
Deborah.
that's what that refers to, and I'm not sure if the person who's writing that question is referring to the money that's available from the federal stimulus individually to households based on either having children or your income level.
Thank you. There was a change in my Medicaid service that happened October, November 2020, where residents that had just Medicaid and didn't need any insurance provider now have to pick an INS provider, which is causing issues with not being able to see the doctors that know theirs on good condition and being able to get medical treatment, and that was already pre-approved. Many residents was not aware of this change in Medicaid and having a hardship of getting the care they need. Can you please explain the change in the Medicaid program about this issue?
So this issue is around a change in a process. As Director Zeilinger mentioned earlier, the policy for Medicaid or medical assistance is through DC Healthcare Finance. So I would, and again, this sounds like it's a personal issue. So we would like that resident to send us her phone number or her contact information. We will reach out to that resident and we will at this time.
Is
Ms.
it
Moore,
possible?
how do you want people to give you information? And if the council member's office receives inquiries, what's the best way if people have those types of questions for them to contact the agency and get issues resolved?
I'm sorry, Deborah. My apologies, Ms. Seymour. Please.
Okay. For some of the chats that were coming in, either through the chat or through the Q&A, I have been responding and asking residents to provide us with their contact information. We have a team member who's on standby with us tonight who's reaching out to those customers and is doing the connection. So we've been doing that during this call.
Awesome. Thank you for that.
Meeting, residents with those types of questions can always call our call center and we will help them navigate the issue, whether it's an eligibility issue or an issue they're having with DC Medicaid. So public benefits questions, people can check our website, they can call our call center.
Ms. Seymour, would it be possible to add that to the chat, the telephone number, any contact information, so our residents will have that in the chat?
Sure.
There's another question, but I want to turn it over first to see if Jules have any questions on Facebook.
Miss Streeter is actually answering everything on the Facebook, so we're totally sorted there.
That's wonderful. Sounds good. So I am also there. Okay, we answered that question. So can you be able to receive PEBT if you receive unemployment?
So PEBT is based on whether or not a child is eligible for a free and reduced lunch and does not have anything to do with unemployment. So yes, the answer is that children will be eligible to receive PEBT, whether or not their parents are receiving unemployment.
Okay, let's see. I'm trying to go through as you answering, so I don't repeat any of them. Not a personal issue. It's happening to a lot of residents. I think that's the call center question, so we're good with that. Who do we contact about the PEBT? I think we just addressed that as well. Also, I haven't had insurance in about 4 years. I have children, but I don't know how to receive it. I don't have any SNAP benefits. Is there a general response to that?
I'm sorry, I was in the midst of putting the phone number in the chat, what you asked me to do.
No problem.
Do you mind repeating that question for me?
Absolutely, not a problem. Also, I have not had insurance in about 4 years. I have children, but I don't know how to receive it. I don't have any SNAP benefits.
Do you mind asking that resident to provide her information to us and we will reach out to her?
Okay, I think that person heard it directly from you. So please provide your information to Ms.
I have also put the call center phone number and the hours in the chat.
Great. Okay. I've been waiting in ERAP for 3 months, and I did everything they asked me to do, but never heard from anyone. What do I do now?
Okay, I'm going to ask Ms. Pierre to chime in on what to do if someone's waiting on their ERAP application.
Sure, thanks. This is better. Sorry, I often have issues with my sound, so I had a second device. So it takes up to 7 to 14 days to process ERAP applications. And if someone has an issue with their current ERAP application, they can reach out to erap.program@dc.gov. But I will follow my colleagues' theme that if they want to send the information directly to you and to us, and I'll have somebody in my team kind of follow up directly, because according to the question, it's taking more than 14 days for this resident to get eligibility. But on average, it should take us between 7 to 14 days for eligibility, but we can follow up with the resident directly.
And I'll note too, we did receive a huge volume of ERAP applications and had the same people to process. As we are growing the new.
Laura, I think you're speaking, but we can't hear you.
I am. Can you hear me?
We can hear you, Laura.
Oh,
it's my sound. I'm so sorry.
Okay. So I want to just note that we did have a backlog in ERAP applications, and we've been working through it. And so it does. If you have not heard, do let us know, and we'll make sure the application isn't lost. As we launch the new federal assistance, which is a much larger program exponentially than what ERAP offers, we will have an entirely new infrastructure to support it. And we will be better prepared to rise to the level of need that has grown in our community for rent assistance. So if we are excited that you will see some improvement for us in the way we're delivering services over the next in the next week or so.
And I'm on mute. You would think after you guys get that together. So it's a question about the landlord rental assistant. It appears to be a burden on the landlord if the tenants do not sign the form and receive notice of application. What should a landlord do?
Thank you.
Picking up somewhat? Okay.
Ms. Lockbridge, can you repeat the question, please?
Yes, this is a landlord rental assistant question. It appears to be a burden on the landlord for tenants if the tenants must sign the form and receive notice of application. What should a landlord do?
Sure. So I think this is referring to the new program, DC Stay. And it's one of the requirements from the federal government that when a landlord submits an application on behalf of a tenant, the tenant must have to verify that application. To help with this process, the system will be sending notification to tenants that an application has been initiated on their behalf, and they'll be receiving that notification for up to 2 weeks continuously until that information is received from the tenant. In addition, we also strongly recommend that landlords notify tenants that application is being initiated on their behalf. And once the application is processed, they would be able to provide update on the status of the application now.
Thank you so much, Noah. I want to add just a couple things to that. I think there's a lot of information that people don't have right now about how that program works and how receiving that assistance might impact them. So people, for example, who apply for ERAP, historically, we've only been able to provide that assistance once in a year. And so if they may not know what kind of help they can get if their landlord has applied on their behalf. And we want to, and this is we have our ERAP rules have changed as well as the rules for this new federal program. So we have a lot of communication materials that were developing for landlords, for tenants, about the new program that we hope will address a lot of those questions. Because someone just may not trust that they're, it may be an issue of trust, right? That what will happen if I can't pay my rent going forward? My landlord's asked for this help, and I still am going to need help in the coming months. That's a real situation that people have, and they need to be able to ask that question, have it answered. So when they get that email, I think there will be a place where they can call with questions, where they can talk to somebody, address them, somebody if they don't want to ask their landlord, if they want to ask DHS those questions, or the people doing the work on our behalf, our contractors, and for this program, we'll make sure they're able to do it. We encourage landlords as well to reach out and say, I'm trying to get this help for my tenants and they're not signing, and we will try to help you solve those issues and understand really what's at the root of that. So it's a new program. We understand that there's what we envision, what we hope happens, and then but people are going to have their own questions, and we want to be nimble and answer those.
Great. As a reminder, I see a couple hands up, but if you would put your questions in the chat or in the question and answer, we would get to them. We have a few more moments. We wanted to target 7:30, so we have some time to answer some more questions. At this time, I'm going to recognize our Director of Constituent Services, Wendy Glenn, for her question.
Yes, my question comes from property management companies who have large complexes throughout Ward 8. So I was asked the question because I sat through the demonstration of the new launch of the application on last week. So the concern that we had, or that they had, that have asked me is it possible for DHS to come and do a ERAP sign up at their particular complex, so that it's not like, so they'll know exactly who's turning what in. They already have the documentation there. And I'm just going to use this complex as an example. Congress Park. You already, like Edgewood would be on site. They have the files. The tenants are ready. They could do it building by building. ERAP application sign up. The documentation is there. They're there. The tenant is there. So is there any way, or have you all thought about doing large emergency rental assistance sign-ups per complex in Ward 8?
Director, I'm happy to take the question if that's okay. So thank you for your question. So we want to make sure to distinguish between ERAP and the new federal assistance program, which will be called DC Stay, because the eligibility criteria is wider than our current ERAP program. So we want to make sure that folks think about this new program as DC Stay, but we're working with our partners to do a better outpatient communication so residents know exactly what they're eligible for. While we have been necessarily identified as suggested kind of targeted wide-scale emergency applications for certain groups, we are working with our stakeholders and community partners to actually do some similar kind of outreach, maybe hold wide fairs, right? So then it will be somewhere where there are computers, as you say, the residents come with all of their documents, and then there will be trained either DHS or DHS representatives, folks who've been trained on how to support residents in completing the application. So we are planning on launching some of those workshops with our community partners. I don't know, Noah, does you want to add something to this?
Yes, I just wanted to add, we're working very closely with the DHCD, DC Housing and Community Development, and the Deputy Mayors for Economic Planning and Development to come up with the most robust outreach platform and effort that would include reaching out to all community-based organizations, providers, landlords, and everyone who's working with us to make sure that this information is out there, but also to provide the support that residents will need to complete the application. We understand that not everyone has the platform and technology to complete the application online. So that's also something we're working to make sure that we're providing that level of support for residents.
Great, thank you so much. We're gonna go back to the chat with some questions. This one is, what should families do?
Thank you for that question. I will put the link of our web form also in the chat, and I'm asking residents to complete a web form, and we will get back in touch with them. I'll go ahead and do that at this time.
Thank you so much.
Thank you.
There's an income with an income of $763 monthly. Would I be qualified for SNAP benefits?
Regarding that question about an income floor of $763, it is hard for us to determine whether or not there could be additional income, any shelter allowances, and it's hard to say yes or no that someone will qualify. We're asking for that resident also to contact our call center, and we will work with them. Additionally, we have a link on our website where residents are able to put in answers to 5 questions, and it will give a quick sneak peek if they're eligible for SNAP. But again, we recommend that they call us.
Awesome. Thank you so much. This one, I believe.
Regarding the additional funding that they received on their PEBT card, it was just the difference between the amount that families were eligible for at the beginning last year during the beginning of the pandemic and at the beginning of this school year. We have not yet distributed the larger amount that Director Zeilinger talked about because we recently received approval from the federal government, but we are still awaiting a second approval before we can proceed.
Great, thank you. Is there a specific number or point of contact solely for PEBT? The DHS number isn't helpful.
We are accepting questions through a web form. I will provide the link in the chat for the web form. As soon as we receive the second approval that we're waiting on from the federal government, we will be able to stand up a call center, but at this time, we do not have a PEBT call center. We're asking for your patience at this time.
Great, thank you. I think we've answered this about an email. I think you put all that in the chat already. This is a pretty long one, so give me a moment. And it says, hello, I know I haven't gotten this yet. My question, are there pandemic service for us who work? I work with DCPS as a teacher assistant and due to school closing, there's no aftercare, which is usually my part-time job to help make ends meet. Also, we are not paid during the summer months due to the clause in the DC government that says, if you have reasonable assurance of returning to work, I've reached out to the council members before on changing this clause in DC and never heard back. So when I return to work, I'm always behind on rent, etc. But as for now, every time I apply for pandemic services for rent, I'm told I'm over income due to my pay stubs shows a yearly rate, but I'm only a 10-month employee. Just because some of us are employees doesn't mean we don't need help during the pandemic. Any response?
I can answer that. The new emergency rental assistance program for families who are within 80% of AMI who experience reduction of income due to COVID-19 to receive certain services. So it really will depend on the AMI where the family experiences, where the family's income falls, and that they can prove that they've experienced a reduction of income due to COVID-19.
So the other thing to note too is the rent, the eligibility amount for rental assistance has changed recently, so that 80% of the area median income, and there are charts on our website that show what those income tables are, help somebody know. So it was a pretty low income threshold before someone was ineligible for that assistance before, and it has gone up. And that is, so it may be helpful to more residents, but we do understand there are people who are working and still struggling. We do not make the rules for the federal rental assistance program or many of the federal benefit programs, but you can, we do have, and maybe Ms. Seymour can speak to, we do have a calculator on our website where I think you can put in your information and know whether there actually is relief that you would qualify for. The other thing is, I think in that question, it was over the summer when somebody is not seeing income, they've been deemed ineligible. We look at income, I think, and I'm going to ask the program to make sure I'm correct here. We look at income in the last 30 days when we're doing eligibility. So if you've lost income in the last 30 days, I believe that we are not only looking at your annual income, but for emergency rental assistance, if you've lost income in the last 30 days, and that would be also including if you're don't have income over the summer. I think we would be able to help you during that time. Yes, it's 30 days that, so you, but do feel free to reach out to us about your specific situation and make sure that you're sharing information that you want to be considered based on your income over the last 30 days, and that might help.
I think we have maybe three more questions, and I think we're maybe right on time. This one is, how long does it take for child application to be processed to receive confirmation of application has been submitted?
We don't process ourselves the chat applications, but I asked my colleague Noah to just maybe give a little bit of information on that program. But the chat application,
I don't think we have data on their turnaround time for CHAP. We can ask them to provide that information, the council member's office, if you have an application for CHAP that's pending. But unfortunately, we, because DHS is an administrator of the program, we do not have those metrics, but we're happy to facilitate a response.
Sounds great, thank you. This is a follow-up question. I think this is from the part-time employee. Are there programs from the pandemic programs for those of us who work but are still struggling due to losing part-time jobs? So the first question, she explained a little bit. Now she's asking what programs may be available.
So it would really depend on the specific income for that individual. And so we would encourage, you can go to our website and take a look at, and Ms. Seymour just posted in the chat where you can ask questions about PBT, and we will also post where you can look at based on your income if you're likely to qualify for SNAP, and we can also point you toward where the income tables are for rental assistance. But it is really about how much you earn, not whether or not you're working. I think this is an area where I want to note that we're really focused. We know that many people are working and still not making enough to pay their bills, and it makes it so some people can't afford to go ahead and increase their income because they lose access to those essential benefits. So we are really trying to figure out a way that we can bridge that gap between what it actually costs to live here and our cost of living, but not here. How we help people bridge to where their earnings are on par with the cost of living. So we understand that's an issue that needs your government to work for you differently, and it's something that we're in conversation with our workforce development partners, as well as the mayor's office, and how we might find some different kinds of relief in those situations. So stay tuned on that. That's something that we really are focused on, but we don't have a great answer that works for everybody right now.
Thank you, Director, for that. The last question we have here is, I received a $100 emergency EPT allotment back on March 30th, 2021. And it was saying it's a benefit status change. And I wanted to know what exactly does this mean, and when will the allotment be released?
In contact with her.
Sounds great. Well, that's wonderful. I like when we start on time and end on time. This evening, answer questions that our constituents had. So on behalf of Councilmember White, as you know, had to leave. He had a candlelight visual and he was in between another meeting. But I'd like to thank you all so very much for your time, for the information you shared, and for your just willingness to serve the community. All the best to everyone, and everybody have a wonderful night. Before I do that, that is not polite. Director, is there any closing remarks that you'd like to have before we end our meeting?
Oh, I think you've heard enough from me for the night. I'll just say, wishing everybody a wonderful evening. I want to again thank your office, Ms. Lockridge, and the council member for inviting this conversation. We know so many of the residents who were here to serve live in Ward 8, and we are so happy to have the opportunity to be in direct dialogue with you. And we are really hopeful for the additional resources that are available. And so share the information that you learned tonight, share it with your neighbors, let people know. We're very excited about the assistance that we have to offer, and wishing everyone just to stay very safe and well during these challenging times. I want to thank not only your office, but I want to thank my entire team, who many of whom have not even had a weekend day off since the beginning of this pandemic, and have really are working tirelessly to improve the services that we offer and make sure you can receive them. So thanks everybody, and wishing everyone well.
Thank you so much, and kudos to your team. Everyone stay safe out there and have a wonderful night. Thank you for joining.
Everyone, have a good evening.
Thank you.